Hello, everyone. Today, I'd like to talk about how we can improve our patient encounters through customer service and an effective approach to their care. My name is Bob Smith, paramedic and EMS chief. Some of the objectives we'd like to go over with this course today is that our end goal here is that students will be able to identify 10 ways to improve their patient encounters through customer service and an effective care, as well as students being able to understand those customer service skills and apply them to an effective care treatment to patients. And last, students will be able to identify an effective approach to patient care and how it relates and benefits to the patient encounter itself, as well as indirectly relates to the patient encounter or how it relates outside of that specific encounter itself. Here's a quote from Maya Angelou. You may or may not have seen something similar to this before. I've learned that people will forget what you've said, people will forget what you did, but people will never forget how you made them feel. Take a minute here and think about what you think that statement means in regards to EMS and the pre-hospital healthcare setting. To understand this a little bit better, we need to understand the difference between effective and affective. There's effective care and affective care. Essentially, effective means it's an adjective that describes something that leads to an end result, meaning we've done the steps and the tasks in order to achieve the goal that we want to see. Affective care is an adjective that describes something that is either based on an emotion, expresses an emotion, or is influenced by an emotion. So to help understand this a little bit better, we'll give you a short scenario here. You get dispatched late at night to a residence for a 92-year-old female, sick person, non-emergency response. You arrive on scene, find this elderly female walking about the house. She begins to tell you that up until 2 weeks ago, she was considerably healthy, to the point that she had no diagnosed medical history and took no prescription medications. However, 2 weeks ago, she was at her family physician, or PCP, and was diagnosed with a cardiac condition. She doesn't really specifically remember what it was that she was diagnosed with, and she's a little frustrated about the situation, and she's frustrated that she now has to take a variety of new medications. To get to the point, she tells you that she called 911 tonight simply because she was scared about what was going on. She's confused about what's going on and is generally just afraid to fall asleep, that she might not wake up. She insists that she goes to the emergency department to be evaluated by a physician just to make sure that she's okay. We can provide effective care for this patient simply by monitoring their vital signs. For this lady, we find out that for the most part, her vital signs are within normal limits. At rest, her room air oxygen saturation is 97%. However, she gets up and moves about the house. You reassess her and find that her pulse ox has decreased to 91%. At rest, again, it goes back to 97%. So a little bit of a change there, but nothing too dramatic. You administer, supplemental oxygen, 2 liters per minute via nasal cannula, and give her a transport to the local hospital. Simply put, you've provided effective care for this patient. Now, we can discuss affective care and what else can we do for this lady. We can review her recent discharge paperwork or the report from her PCP. There we find that she was diagnosed with a low ejection fraction. We know that a low ejection fraction can cause weakness and shortness of breath upon exertion, which is her case that has been going on with her diagnosis. You can reassure her on the way to the hospital and tell her that the staff there at the hospital is more than happy to take care of her, and chances are that physician is going to be able to explain her medical condition a little bit more in detail than what you're going to be able to. You also express to her, that it's very important that she continues taking her medications. There's a plan of care in place for her. We have to trust that those decisions that her physicians have made for her. There really isn't much more that you can do for this patient other than the supplemental oxygen, as well as the transport to the hospital. However, we can also smile. We can also make her feel a little welcome that she's, where she's in our care. We can ask her about her hobbies and interests, potentially take her mind off the current situation. And you know what? We could probably hold her hand on the way to the hospital, since there isn't much more that we can do. Simply put, we've showed that we can care for this patient. What's some other ways that we can show how we care for our patients? Well, one, we need to dress for success. Professional appearance indicates that you take your job seriously, which means when you arrive at someone's house, they have this immediate impression that you care about your job, which means you care about their health and safety. We can be prepared. This starts before we even get dispatched to a call. We make sure that all our equipment's lined up and in good working order, and that everything's there that we need to take care of for our patients. The last thing we want to do is show up to someone's house and find out that we don't have essential equipment to take care of them. Third, be knowledgeable. We need to know our basic clinical knowledge, our scope of practice. We need to know what our protocols are, all that stuff. We need to know how to do our jobs and provide effective care. Number 4, body language. 90% of all communication is nonverbal, so this is a very big one. How we can do this is we have a good posture. We make sure that we make eye contact with our patients, that we have reasonable tone to our voice, and then lastly there, just smile. Active listening doesn't necessarily mean that we're listening while actively doing something, but it means that we're listening with a purpose. We need to show patients that we are paying attention to what they have to say. Number 6, we can engage everyone. Now, this isn't just patients specifically, but we can also engage bystanders and family members. I'd like to point out, if you've ever had overly concerned family members that kind of seem to get in your way and they're very anxious about it, their anxiety level is not very beneficial to our patient's care. Them getting in our way, may complicate, the things that we need to do. So I like to assign them an important task to do, whether that's moving furniture and stuff out of the way to extricate a patient from a home, or simply just have them, write down their list of medications or hold the stretcher still while we move someone onto it. Number 7 is going to be time management. We need to be ready to respond. Again, this happens before we even get dispatched to a call. We need to move with a purpose. So when those tones go out or the pager goes off, we need to actually be able to get up and go. How many of you have experience with a partner who, gets dispatched for a call, and we now have to put our boots on, we need to get a drink of water, and now, they need to go to the bathroom before we head out the door. We need to be able to just get moving, as quickly as possible. Provide explanation to our patients. Many of our patients don't have extensive experience in medicine or emergency medicine. They don't know what to expect. So, if we're able to provide some explanation and understanding of the things and steps that take place, on the way to the hospital, it provides a little level of comfort that they understand what's going on. They're informed about what's happening. This could be as simple as, explaining how we're going to, transfer a patient onto a stretcher and get them out to the ambulance, what interventions we need to get to. For those ALS providers out there, how many patients, have you had where you've gone to start an IV and they're suddenly shocked, that an IV needs to be started. Let's explain that stuff before we even get to that step. The other thing is, what type of effects, they may or may not feel from medications, and the last thing there is explaining, what they can expect once they arrive at the hospital. Number 9 is being an advocate for our patients. We need to do what's best for our patients. Some patients, again, don't have the extensive experience in medicine, so we need to speak up for our patients and let them know, hey, tell the nursing staff or the physicians at those receiving facilities, hey, they're confused about what's going on. They need a further explanation to it. Again, we got some mandatory child and elder abuse reporting in there as well, so we need to speak up for those individuals. Last here is number 10, empathy, which is the ability to understand and share feelings, for another. We need to understand the patient's perspective. So that's the big part of this here, is understanding that while, yes, you may not think that, an emergency or an emergency call is truly an emergency, from the patient's perspective it is. So we should treat it as if it actually is an emergency. Some honorable mentions here. Is laughter the best medicine? Well, there's some science behind, the benefits of laughter in improving one's health. Try to provide some compliment to the patient. I like to refer to patient refusal departure stuff. Before you leave those non-transport calls, is there anything else that we can do for that patient before we leave? Especially the fall victim, turn lift assist type of thing. Can we move, rearrange furniture and stuff to prevent any other type of falls, things like that? And a big one here is asking your patients, if there's anything that you could have done better to improve their experience with you. Another one is following up with your patients. There's not a lot of times when we have the ability to check up on our patients, but if you do, in a busy hospital system, it's always nice to follow up with them. Again, it just shows that you care about their well-being. So why is this all important to us? Well, one, it improves patient satisfaction. That's our goal. We want our patients to be happy. We provide a service, essentially they're customers, so we want happy customers. The overall experience and patient satisfaction can lead to a lot of other benefits here that we'll discuss. One, can benefits or can patient satisfaction benefit outcomes? Well, there's some correlation to that, whether it's the outcome that makes good patient satisfaction or patient satisfaction makes good outcomes. But, if we're advocating for our patients and providing the best possible care for them and doing everything possibly that we can for them, we can actually find a way to shorten our ED stays. If you're able to draw labs on someone, we can potentially cut down their their time in the ED by 2 hours. If we're able to advocate for our patients, to get physicians to pay a little more attention to them and treat them, faster or more aggressively, we can actually reduce their time that they spend inpatient if it turns out that way, which is a huge benefit for us because later on in the afternoon, busy day, you'll have more beds available if you can move patients in and out of that ER a lot quicker. It'll also help us better prepare ourselves for uncooperative patients. So, if you have the uncooperative patients, if we provide good customer service to them and we're acting in a professional manner and showing that we care for them, we may actually be able to de-escalate situations or even better prevent situations from becoming tense and avoiding a de-escalation situation entirely. If we're doing the right thing for our patients and acting in the mindset of doing the best care for them, we can avoid some type of, ethical situations there as well. A big thing here is that it promotes trust from the community and it promotes trust from our municipal leaders. This leads into our next one, potential improvements in revenue. Satisfied customers and satisfied patients tend to pay their bills quickly, and they tend to pay them entirely and in full. It also leads to community support, which can lead to, better fundraising, more donations from the community. Finance and EMS right now, is a stressful situation. There's not a whole lot we can do to control that, but if we can get some community support to support our EMS agencies, that's even better. The last thing here is that trust from the municipal leadership secures that we continue to have good working agreements with those municipal leadership and governments, and potentially lead to better funding from those governments and municipal leaders as well. Now, not every patient encounter we're going to have is going to be a positive one. We are going to have poor patient encounters. The big thing with this is as long as we're acting, with care in mind, an affective approach to them with good customer service, we can avoid, even further poor patient encounters. Those negative interactions, we need to brush those off and make sure that they don't affect us on the next one or the next call and have a bad outcome for our patients, later down the road. Ask your patients, what you could have done better. If you don't think that it went well, just ask them, in their opinion, what could you have done better from, and learn from it. So to review, affective care is showing that we care for our patients' well-being. We're going to dress for success. We're going to be prepared. We're going to be knowledgeable in our skills. We're going to use good body language. We're going to actively listen and pay attention to our patients. We're going to engage everyone, including the patient, bystanders, family members, facility staff, all that. We're going to use appropriate time management skills. We're going to provide explanation of the treatments that we're going to provide, what the patient can expect moving forward with the encounter. We're going to advocate for our patients and their well-being, and we're going to show that we have empathy for them and their situation. Providing good customer service and effective care for your patients has a positive meaning, way beyond the patient encounter itself. Again, we go back to those benefits that we have: community support, municipal support, and that. Not every encounter is going to be a good one. We need to learn from those and improve. Any questions? All right, some assignments for you here. Just to follow up and recap everything, we'll provide a short answer here. What are 2 ways that you can improve your effective approach with patients, specifically using, the methods that we've outlined here. And number 2, should EMS education programs and EMS agencies make customer service and effective care a priority there? What are the benefits of doing this? All right, folks, that's all I have for you today. Thank you very much. Have a good day.